Okay, we're live now. Thank you, Chair.
Good afternoon, everybody, and welcome to the virtual meeting of the Children and Young People's Social Care and Scrutiny panel. Welcome to all members and visitors today. The meeting is being live streamed via the Council YouTube channel, and whilst members of the public can view the meeting, they will not be able to actively participate or comment on proceedings. As the meeting is being live streamed, I would like to remind all participants that their conduct should reflect this. Normal rules of procedure apply, with any questions or comments directed through the chair, please. Thank you. Can we commence the agenda now with agenda item number 1, which is apologies for absence?
Yes, Chair, I've received apologies from Councillor Higgins.
Thank you. Have we any declarations of interest? I'll take that as a no. Agenda item number 3, the minutes of the previous meeting held on the 25th of October. Can we agree these minutes?
Move them, Chair.
Thank you. Now we'll go on to agenda item number 5, which is locality working that we're scrutinising at the moment. And we're expecting...
4.
Sorry, agenda item number 4. Yeah. Sue Butcher, Executive Direction of Silver Service Children's Services, is in attendance today with a number of officers who will be introduced in due course. Can the officers speak up, because I'm not quite sure which ones we've got in the meeting, or can you inform us, Joe, who we have?
Yes, Chair, sorry. Hazel Clark's just popped up on the screen there. Hazel's one of the team managers. We've got Rachel Farnham with us, who's Director of Children's Care, Gail Earl, Head of Prevention, Adam Parkinson, Neighbourhood Team Manager, and Angela Hill, who's also one of the team managers.
Right, thank you very much. Are we expecting anybody else to join us?
No, Chair.
Right. What we further to our details around how children's services element of local locality works, and it's actually working in these areas and how it can be improved going forward. Can we have the presentation from Sue? I do believe everybody has been sent this presentation, and I hope that everybody's gone through it. Thank you. Would you like to carry on, Sue, please?
Thank you, Chair. What I've done really is put together some quite basic details about locality working, some of which you will have seen before, but I thought it was useful to just set the scene, and then we can bring my colleague officers in to just talk a little bit more about it, maybe in their own roles. But what I really would like this to be, and I know we've discussed it, Chair, is this a discussion around locality working and how we all feel that it can work and how it can work better in children's services, but also I think we can touch on how it might be better corporately as well. By better, I'm not being in any way derogative, I just mean developing and developing well. So really we want questions, discussions and challenge on locality working. So I'm just going to talk a little bit about early help. It's called Stronger Families, and I'm sure Gail will come in and add a little bit to what I'm saying. So Stronger Families Early Help has got 3 practitioners, 3 senior practitioners who are working in 2 localities, and they've been there for the past year, and 2 in Newport and 1 in North Ormsby. Referrals to North Ormsby or for North Ormsby and Newport come either through the multi-agency Children's Hub, which is the front door for children's services, or it's from work that's stepped down. And by that, we mean that it's been open to a social worker has been working with the family, and then a family doesn't need a social worker anymore, but still needs some support. So it gets stepped down, as it were, to Stronger Families. And the work is immediately allocated, but sometimes we've found quite recently that some of our early help colleagues have got quite high caseloads. So then occasionally it has to be allocated to other staff across the service. However, I know that the team managers and the assistant team managers work really hard to make sure that that doesn't happen. So you have the locality locality officers picking up the work from that locality. Gail and Hazel, did you want to just come in and say a little bit more about the demand that's coming through?
Yeah, so we're experiencing high demand within early help services, not just in these two localities, but across other areas of Middlesbrough as well. And all of the families that come into early help into stronger families do come through the multi-agency children's hub. And when they're so we do allocations every day so that families get a swift response. And when a family is allocated to one of our practitioners, our guidelines for staff are that they must contact that family within 3 days so that when families are experiencing difficulties, they get a quick response from staff.
Thank you. So, and then we just move on to the social care teams, the social work teams, and we've got Angela Hill with us. Angela, I think, is this your first time at Scrutiny?
Yes, it is. So,
all right, so watch and learn. Okay, so initially we had one social worker allocated to each locality, one to Newport and one to North Ormsby. That was quite quickly found to be insufficient and that we needed more capacity. So now we've got 3 social workers allocated to North Ormsby and 2 linked to Newport. So we've got referrals to social care are again made through the multi-agency children's hub, and that can be from families or from professionals working with children. So if it's a new family and they don't have an allocated social worker already, the work with that family will be allocated to our assessment service for an assessment. So if then the assessment identifies that more work is needed, then the work with that family transfers into the next part of our service, which is the safeguarding and care planning service. And then at that point, if it's identified that it's a locality, either North Ormsby or Newport, the work is allocated to a worker that's allocated to one of those teams. At the moment, there's still a bit of transition going on because some workers already have some work from Newport and North Ormsby, and you don't want to change children's social workers, whilst you're sort of, children build relationships with social workers, don't they? So you don't want to change them if you don't need to. But as the work progresses, as social workers move on work from other areas, they will gradually take on the work from Newport and North Ormsby. Now, one of the exciting things I think is that we're beginning to consolidate that. And I wonder whether, Angela, you could tell us a little bit about the fact that you've now got one team for locality working.
yeah, so previously the 5 social workers across the 2 localities were based across the service. So we're in several teams, 4 or 5 teams across the service, which kind of created a bit of pressure with allocations and throughput. So it's been agreed that to try and manage that better, it would all come together in one team with one manager, and that's my team. So it's going to be me as the identified manager for the 2 localities, and I've got a team of 6 social workers. So 5 of those social workers will be based in the 2 localities, and I'll have an extra social worker to, just for that extra bit of capacity if needed. But over the coming weeks, the priority is going to be to fill my team just with Newport or North Ormsby families. That's the goal over the next few weeks.
And Angela's been involved with locality working for quite a long period of time, actually. You've been a bit of our trailblazer in children's services. And I know it's something you've been really very keen and passionate about. So big thank you to you for that. Rachel, is there anything you'd like to add about the, the new team coming along? Or generally?
No, I think certainly from an early help perspective, which Gail's touched on, and from a social care perspective, they work really closely together to make sure that children who receive an early help service, if that needs to step up to a social worker, they do that seamlessly. And I suppose the only thing I would add is the added value that all of the managers describe from being together in the locality hubs. There's been a bit of COVID impact in relation to that along the way, but those weekly meetings and spending time with colleagues in the locality teams has been described as, you know, a really positive step.
So we've got some information about what's working well and areas where, you know, let's call them areas for development really, because it is all, you know, relatively new still. And I'm sure Adam will talk a little bit more about some of the background. But we do feel there's a lot of benefits. So what you have is joint visits with other professionals working in the area. So, you know, well, when I was a very young social worker, which was a considerable amount of time ago, you could go out with, say, an adult social worker. So you could go and look at the whole family, children and adults. Now, that's a slight red herring in some ways. Sorry about that, because we haven't got adults in the localities yet. But you can see how two different parts of the council can work together. Adam, if you've got a better example than I've just given, in terms of maybe street wardens or something like that working together.
Yeah, absolutely. I think one of the main benefits has been the sort of the diversity and the amount of offer within the locality settings. So Newport specifically, we've had members of our community development team and I think minority achievement team who've been working with families who've assisted with those joint visits. Street wardens, again, we've got allocated street warden presence there, so they are visual and they're really well known within the locality. So in a lot of cases they're sort of a trusted professional and they've assisted with information, but also with, you know, those initial introductions, etc. as well. So I think the value of having officers that are known to different parts of the ward and the residents and that information coming together has been really positive as well.
Thank you, Adam. So one thing that I think is really good is that, well, I think it's very positive that families in their respective localities are beginning to recognise staff and beginning to know that they are staff that are dedicated to that area. So I think that can start making relationship building stronger. Greater knowledge of the community and partners, building up those relationships that Adam's particularly talked about. And we've got neighbourhood wardens and housing. I mean, housing absolutely crucial, of course, to working with families. Improved relationship with schools, as practitioners are working with fewer schools, so they're not working with every school across Middlesbrough. As you know, a social worker who's in a team that's not a locality team can be working with a whole plethora of different schools, but it's just a few schools that have been worked with. More effective use of professional time, and you know, maybe more mundane, but just as important in some ways, there's a reduction in mileage. Some of the areas that haven't been working so well, but are still getting there, the pandemic. I mean, the pandemic has held up some things, but it's happening, it's been happening, but now people are beginning to get together for those meetings a bit more. That partnership element is improving. I put from an early help perspective, I think that you could always have more capacity in the localities, Gail and Hazel. I think there's enough work there for lots of practitioners, but we have to be realistic about the capacity. Hazel, is there anything you could come in and talk about there?
Yes, Sue, thanks. I think one of the other things to think about with the early help work is that we would also take cases back as well. So if a family did close to us after positive outcomes but then came back in, they might also they would go back to that same practitioner to keep continuity, which sometimes that then increases the caseload, Sue. So where we might have got a caseload manageable, that might slightly increase that caseload, but actually for the family and the children, it's much more beneficial to keep that continuity there. I think working with our partners, though, is really strengthens that kind of where we have got high capacity is working more closely with partners. And we're also, when we might have done the work we needed to do, we would look at other agencies being involved offering early help as well. So that might be that case is closed from Stronger Families but is opened with a school and tracked and monitored, or it might be monitored through health or other partners that have got a really strong relationship with that family or those children. We've got an example of a case where we've been working close with neighbourhood safety team. So they come to the reviews that we hold. So Gail talked about how we allocate a case within so many days. And then we make sure that we've done an assessment and a plan for that child and family. But as part of that, we work together with other agencies, and they form part of what we call a My Family Plan review. So they would be invited to a multi-agency meeting to make sure that we're all working more closely together. And I think the locality working is really beneficial to get people like neighbourhood safety staff around the table with people from schools and from the local authority from a Stronger Families point of view is really rich in the benefits for the children, young people and families.
Thank you, Hazel, that's great. The one team approach that Angela's described to us, it's still embedding. It's really quite new, Angela, so we've got work to do to develop that. And there's something about expectation and understanding of pathways, and we need to make sure that where issues are identified, the right level of practitioner becomes involved, the most appropriate practitioner becomes involved, and that screening still happens, you know, where a social worker is due to be working, where it's the right level for a social worker, that a social worker does and an early help worker does. So locality is not a shortcut to receiving, it's not a shortcut to getting a social worker, for example. Weekly disciplinary meetings for all practitioners, and there's been I've put there that they can be useful, these weekly meetings, but they do focus to a large extent on environment. However, I heard from Marion this morning, Adam, that there's going to be a subgroup which is going to be focusing on children, on families, or that's what she said to me this morning. So that sounds to be a very new development coming our way. Towards the end of the paper, I've put about caseloads. I won't go through them in detail, but you can see that for the senior practitioners in some of the areas, they really are quite high. The social work teams, all social workers across the town are not allocated any more than 25. So the locality workers are around that number. And then we've got some quotes really at the end. I think they're really positive quotes. I do really think the concept works, or if I put it another way, I really would not want to go back to town-wide working. From families, brought A out of himself, and he's doing a lot better than he was. She was really nice to talk to. I'm not sure who the she was, but she was really nice to talk to. The support has been well received and everything is going well. This time last year, I was so depressed. Now I am working and have a nice house. I don't struggle to get out of bed anymore. I think that sort of says it all really, doesn't it? So I'm just wondering if colleagues, particularly you, Adam, if you want to say a little bit about the fuller locality working, just to give that sort of broadest perspective, and then we can maybe come back to some questions.
Absolutely. Yeah, I mean, the obvious impact of the introduction of the model was COVID, but in spite of that, you know, we did meet virtually on a weekly basis on a Monday and a Thursday to go through and develop several action plans for different sort of high level aims within the model. But I think some of the sort of the data, now that we've into the second year of the model, really shows some of the benefit, you know, on a wider scale, reduction in antisocial behaviour, reduction in long-term empty property, and there is, as was discussed earlier, there is now a real sort of sense of the community, knowing the team, knowing the locality model, as it were, like they see officers on a regular basis, and they know that's something they're involved in, and it's given us a lot of opportunity to have discussions with the wider community about, you know, their ongoing priorities, and how we can work together with them to look at some of the issues or challenges in the ward. So it's been really positive on the whole. Obviously, still developing it and improving it as we go.
Thank you, Adam. That's the paper and some background to the paper, and really it's about questions and discussions and supporting. I'm really very, very keen on this way of working, and I'm very keen, as I know my colleagues on the call are that we make this a success. I think for one of our two most wards where they have the most challenges, I think it's a really secure and effective way of working. So I'd really welcome your comments on what you think of the model as well. Thank you.
Thank you for that, Sue. I'll come to members first. If they would like to come in to ask any questions. Tom, would you like to come in? Then I'll come to you, Alma.
Yes, thanks, Chair. It's about data protection. I think a problem in the past, agencies working together, agencies working together had a problem with data protection and confidentiality. Have you managed to get around this with locality work, and that the agencies can work together easier than they used to? Thanks.
Okay, who'd like to come in on that one? In terms of,
Sorry, Sue, I was going to say I don't mind with.
Thank you, Adam.
Yeah, no problem. Yeah, councillor, we've during the development, and we signed up to an overarching information sharing agreement with a number of our partners in the model, but all information is shared, and it's only shared appropriately. So yeah, we've got quite robust information sharing agreements in place. That answers your question.
Yes, thanks very much, Adam. It does, and I'm feeling more confident about the system. Thank you. Thanks, Chair.
Thank you. Councillor Halawi?
Thank you, Chair. Yes, just to reiterate what Sue said, what Adam believes I know, is that the locality working model is an excellent model of practice. As a local councillor for Newport Water, I do feel closely involved with the locality working, and I'm a huge advocate of the benefits of, actually like you, Sue, I wonder how we worked town-wide before, because if you have locality working, you're so much more easily directly in contact with agencies when you need to resolve issues for residents in the ward. I don't want to advocate it too much in case everybody wants that, and I know there'll be a financial implication, but it is a very successful way of working. And I think that because we have this model in the two more deprived areas in the town, I think that's well placed there to invest in this way of working in those areas. There were a couple of comments I was going to just pick up on. I've just written them down here, so I'm reading them. I think it was you, Gail, or your colleague, who mentioned that sometimes cases that we have are open and then they're closed because issues are resolved. And I picked up with interest that sometimes the cases have to be reopened because of circumstances. And I think that really highlights the challenges that some of our families face, that they cannot just go straight forward in a trajectory of improvement, but they have lulls and comebacks, and their lives sometimes are quite chaotic and hugely challenging. And I think that's a great cause of concern to me, that people live in such challenging circumstances. And I think obviously that social workers will obviously see that at first hand. And I'd like to recognise and show my gratitude for social workers who do sometimes, because of this, as you mentioned, Sue, have to take on extra caseloads. And I'm very pleased that they do come back to families that have already been discharged but need to come back, and they still have greater caseloads. I think the greater caseloads is always going to be a source of concern for us. And just another question I had. So I was just studying. Oh yeah, there were two questions I had on your report. So I just wondered, when you said on the bullet point before you mentioned caseloads, it says the weekly multidisciplinary meetings for all practitioners working in the locality can be useful, although the discussion can focus to a large extent on the environment. Could you just explain a bit, please, what you mean by the environment? Physical, mental, psychological, actually geographical, or is it the poverty, the socioeconomic deprivation environment that we're living in some areas?
That's a really good thought about using the word environment wider than that. I think I'm going to go to either Gail or Adam to talk about the meetings. I think, Gail, it was one of the comments that you put forward to me.
Yeah, because Hazel attends those meetings, but part of the feedback is that sometimes the locality meetings will be talking about housing issues or issues that the street wardens are picking up, or fires, like fire setting, sort of crime that's happening in the area, giving all of the partners on the patch an idea of the different issues that are happening. And I guess that's something that's perhaps a bit new to early help practitioners or social workers, being involved in that level of information sharing about the community, but it has given them a better sense of what the community's facing, what the issues are, and it's helped the practitioners understand a little bit more about what struggles that families might be having because of things like neighbours or you know, because of fire setting or antisocial behaviour. All of those kinds of issues are discussed at the locality meetings. And perhaps in the past or in other models of working, social workers and early help practitioners wouldn't necessarily get that information in their, you know, their week-to-week work. So I think that's what it related to, Councillor.
Understand, and I think it's very beneficial for social workers, as you just said, Gail, to have a holistic view of the family's struggles, their day-to-day struggles in every respect. It's not just one thing, is it? It's everything around them in their psychological, physical, and every other type of environment. So that's very much shared learning, isn't it? And a shared realization, I think, that's come through the locality working. I just had another question, Chair, if I might, based on Sue's
Yes,
report. Is that
carry
okay?
on,
Thanks.
Councillor.
Yeah, I was just looking at the statistics that you gave us, Sue, from the Stronger Families, and it was about the total numbers of children. And should I be concerned to read that there are 58 children open, 58 caseloads of children under 6 months? That seems wow, quite worrying. Or maybe it's a good thing that we've caught children early. It was just the numbers. I thought, is this a huge number? Is this normal? Should we be worried? I mean, are there some specific explanations that we have 58 children with their cases open when they're under 6 months old?
That's across the two localities, but I'll hand over. Oh, Hazel.
It's not under, Councillor, it's not under the age of 6 months. It means that case has been open to Stronger Families. So we really closely track our data. So we're able to say if a case or child's been open for under 3 months, 3 to 6 months, 6 to 9 months, or over 12 months. So that what that enables us to do is see more closely the impact that we're making on a family. So what you can see from that data is that quite a lot of the cases in Newport and North Ormsby are recently opened cases. So we're at the beginning of a piece of work or coming maybe to the end of a piece of work with ourselves.
Thank you. Maybe it was a bit ambiguous and I've misunderstood how I've read that. I thought it was age related, but that brings me to just one more question I had, Chair, if you don't mind, which was how much more specific can we be about the ethnicity of the families in our caseload? I think Sue knows what I'm talking about in having a lot of background there. I mean, I don't need to have the detail now because maybe that's a subject of another debate, but do we have all the data in a more specific way so that we can analyze that? I don't need it now, thanks. I just would like to know that we have it. Thank you.
Councillor, we can drill down further with the data. So we've just given you like the whole figure of the number of children and families we're working with, but it can be split by things like the child's age, etc., different demographics.
Yep, thank you. I think that might be useful if the rest of the panel think that might be useful at some future discussion to have a look at exactly a more drilled down model of the description of the children and their ages and families, etc. Thank you.
Thank you. Now, Councillor Woodin.
Yeah, thank you, Chair. Thanks very much. Thank you for your presentation. Obviously, yeah, I think I'm all for it, actually. I do believe it's going to work. And under your management, I'm sure it will, alongside with your colleagues, Only question I have, when we get the other agencies involved, the different other workers, do we let the family know that so-and-so will be involved along with the social care, social workers and so on? Because sometimes it can be a bit difficult, sort of with the young children or the young families, having too many people involved at the same time, I mean, there are a number of issues, in terms of that as well. But I know if that's needed, like as Gail mentioned earlier on, or is it Angela, when you said, if you need this street warden involved or a housing officer involved, and obviously it's needed, so it needs to be. Or family do need to know the number of people who will be involved. So do we consider that with the family? Check it out.
I think that's a really good point, because you're right. I mean, how many professionals need to be involved in a family's life, isn't it really? And you're absolutely right to minimise or streamline that. But I think Hazel was nodding her head furiously there. So I think I'll come to Hazel and Gail again to talk about how you wrap families around, isn't it, rather than individual professionals going in, as it were.
Yeah. Hi, Councillor. So yeah, from the perspective of, as I mentioned, the My Family Plan review, so that would take account of involving those different professionals or agencies within a family and being part of that. And it is about the model of Stronger Families and Early Help is about the practitioner coordinating that, so that we're not getting lots of people going in unnecessarily. The family don't have to keep retelling their story. We look at the needs of individual families, so we would never make an assumption that all professionals need to be in every single family. It would be based on the needs of that family, and also about how the family or children or young people feel at that time. And sometimes families will say, or children, well, I've got too many professionals with me at the moment, so we would try and broker in that work and potentially do some of that work ourselves as practitioners. Or where we need the specialist, we would involve the specialist, but that would be part of that holistic approach to working with that family, and that would be documented in the My Family Plan that we do, and then the reviews that we do as well.
Can I just add on to that all of the review meetings that Hazel's talking about, where we have partners there, families are there, children are invited, and we sometimes have children and young people that chair their own reviews as well. So they're very much based around the children and their voices, and making sure that they're fully involved and understand what's happening. And all of our work is very child focused.
That's good, brilliant. Thank you very much.
Okay, thank you. Councillor Wilson.
Yeah, so this locality working with families, that question maybe, was this something to do with that building the social services applied for plan permission for working with families on Calculated Lane?
Councillor Wilson, that's a separate subject. Very, very briefly, we're looking to set up a contact centre for parents to have contact with very young babies. It's not connected with the locality working at the moment, although families from the locality may use it, but it's separate from locality working at the moment.
Yeah, that's fine, Sue. Thank you.
Thank you.
Councillor Walker.
Thank you. I'll just lower the hand. Right. Yeah, thanks very much, Chair. Just a couple of logistical questions, actually. Thank you. You actually began, I think, saying that there was high demand across other areas of Middlesbrough with the MAC and allocations every day. Just how many on average are actually being referred out every day? What's the increase, please? And also another part was, the staffing. Are we still got a good complement of staff, or are we losing staff? And how happy are our staff as well? Do we know that?
Are we talking wider than localities at the moment?
We're talking about the locality, yes, because you've got two areas, Newport and North Ormsby. But I'm looking at, it works so well in North Ormsby and Newport. There must be other areas that are looking as though they need it too. And I know for one, I mean, my own area could do with it. And I'm just wondering how do you actually decide which area is going to get locality working? Because that's most important to me as well. And I think it would be nice to see if your demand is coming in at certain areas, where they're coming in from, and how do you actually divvy that up? Because I would imagine that early help at the front door of this service, you'll have to excuse me, my voice keeps going on me. the front door of the service. So they allocate to wherever. And I just want to know, you must have an idea what other areas are looking desperate, basically.
We showed last time some graphs of the sort of need in Newport and North Ormsby, but I think it might be as well to go to Adam at this stage, because Adam can tell you how you chose Newport and North Ormsby, Adam, because it wasn't Children's Services that chose them, as it were, specifically, or at least that's my understanding.
Right.
No, you're correct there. So the two areas were chosen by looking at sort of a number of data sets, from antisocial behaviour to crime, children's service involvement, deprivation. So the reports were put together sort of on the basis of overall need, and that reflects the resource allocation and the partners and the teams that we've pulled into the offer. So that's why North Ormsby and Newport were chosen as the two pilot areas.
So it is just a pilot then, Adam?
At this stage.
How long is it going to be a pilot for?
And until March 2022, it's the end of the pilot period. We're currently already starting to pull together a project report that'll be made available.
Can you just say that again? You're actually pulling together a report.
Yeah, we're looking, obviously at the end of the pilot period, we'll report on what we've achieved and recommendations going forward.
Okay, so at the moment you've still got, I would imagine you're still getting a lot of, you're still getting the referrals for those two areas. Am I right?
Yes.
Yeah, absolutely.
Yeah.
On average, how many increase? What's the increase then at the moment then in children's services?
Do you mean again across the whole of?
Well, I'd like to see as compared to North Ormsby and Newport, as compared to the rest. That would be interesting to see.
I'm not quite sure I'm following you, Councillor. I do apologise.
Right. Okay. You say that there's allocations every day from the MAC.
Yeah.
Yeah. Now into the locality working. Yeah. If that increase is monitored to see how many are increasing Newport and North Ormsby, how do they compare with figures of increase in other areas of concern?
Okay, I'll come to Rachel, who I think
might need to see that on a different, might have to come back with that information.
I think we can give you some information, but we might have to go back and look at the specifics. Yeah. So referrals have increased, Rachel, haven't they, over the last year?
Yeah, contacts and referrals have increased across the whole town. We have quite a sophisticated understanding and analysis about in terms of demand across children's services, and that's both early help and social work services, and we have got that broken down by locality. I don't have that in front of me at the moment, but we certainly can drill into that into some detail where we can compare North Ormsby and Newport, and we can compare it to Berwick Hills, for example, and Nunthorpe, and so that we have got it broken down to ward level. So if Scrutiny is interested in a paper at some point in the future, then we can certainly bring some more detail, but I don't have that in front of me right now.
Thank you for that, Rachel. Can I just come in a moment? I think it's something we can actually look at.
Dorothy, I haven't had an answer to the other part of my question. I do.
Sorry, Jeanette, sorry.
Thank you.
Do you want to just repeat the second part of your?
The second part was staffing. How many social workers have left Middlesbrough service, and are we actually running a full complement, or are we still needing more?
We will always like to recruit more permanent social workers. That's an aim of ours, and again, we've done quite a lot of work on this. We do have quite a high percentage of agency workers at the moment. Rachel and colleagues have just put together, or are putting together, a recruitment campaign, which is looking at incentivising people coming into Middlesbrough as social workers with some experience. Generally, we still have some additional capacity in terms of agency workers in order to keep caseloads down, and we're working through that. So I'll hand over to Rachel, who's got some more details about that. but generally, do we need social workers with more experience rather than more social workers? Yes, we do need social workers with more experience. We want to recruit social workers with more experience, 2 or 3 years at least. And we are seeking, as positively as we possibly can, to recruit those experienced social workers and gradually let our agency staff move on. Rachel.
Right. Thank you, Sue.
I don't think I would add anything, Sue, to what you've just explained there. Recruiting experienced social workers is a regional problem for all local authorities in the North East and is a national problem. We tend to get lots of newly qualified social workers, but we need our workforce to have a balance with growing our new staff to become experienced, but then we also need experienced social workers. So within our workforce development strategy, we've been trying really hard to look at the offer. Why come to Middlesbrough? You know, it's a great town. This is the learning and OD offer. You know, this is the support you'll get from your manager. You will get a manageable caseload, because I know Gail's described some pressures in early help, but across the piece, our caseloads have come down during our improvement journey quite considerably. So we are about to embark on a big recruitment campaign and do some recruitment events, because we want Middlesbrough to become the employer of choice, and we want social workers, good social workers, to come and work in the town. So yeah, that's the only thing I would add, Sue. We are working really hard on that.
So thank you, Rachel. One of the things that you're going to have to do, I think, and that Middlesbrough is going to have to do, is look at what we pay. I would imagine that that is part of the problem as well. And I could be wrong on that, but I would imagine that it might be part of the problem. And also you mentioned, if you don't mind, Chair, if you mentioned the early help having a high caseload, I'm just wondering, how high is the caseload in early help at the moment and the pressures?
Do you want me to answer that?
Yes, please.
The caseloads in early help are higher than social work, but that's to be expected, and that we always run the early help caseload slightly higher than social work, because the early help staff have a different job role and a different remit when they're working with children. So although the caseloads may look quite high, they are a manageable level and they are coming back down. So it's not a concern to us. As I said, the early help staff tend to have slightly higher caseloads than social workers anyway.
Could you give us an example, Gail?
So I would.
Sorry, Gail, I was just going to say, on the chart that you've got on the paper, there are caseloads. We've got numbers of children on caseloads for stronger families. Can you see?
Early help.
Yes.
Yeah.
Stronger families is early help. So you've got a senior practitioner in North Ormsby's got 34, and then the 2 senior practitioners in Newport have got 29 and 28 each, not each, respectively.
Yeah. Okay. So what we'd want to see is caseloads around about 25, 26. So the Newport caseloads are a little bit high and the North Ormsby caseload's high. But if you actually look at the number of families, is quite similar across all 3 members of staff. And so it might just actually be that we're working with some families with quite a number of siblings. And because we work with every child in the family, you know, we work with all of the children in a whole family approach and their parents as well, then actually those caseloads, when you look at the number of families, is okay.
Okay, lovely. Thanks very much for that.
Thank you. Councillor Nugent. You're on mute, Councillor.
I said, thank you, Chair. Sue, thank you very much for all the work you've done and everything else that the staff are doing. However, not adding any more pressure, I would like to know or like to ask if at some point, with resources available, will this program, locality program, eventually be rolled out to the rest of Middlesbrough?
Well, this is a pilot program, as Adam said. I know that Adam's very proud of it and the work that it's doing, and certainly in children's services. well, let's put it, I am very proud of the contribution that we're making. Actually, it's not just me, it's my team. I've got a fabulous team,
Yes, I know.
Absolutely. I'm very much, I'm very old fashioned in some ways. It's the social work that I did was locality. We used to call it patch-based working then.
Yeah.
But you did know which family was on which street and which youngsters were, having hard times, those sorts of things. But it's a pilot program. So we are looking to, there will be a report that gets made and will be presented, I'm sure, to councillors about how we take it forward. Resources, of course, are always an issue. And does every ward need a full locality working complement? Could it be spread out? Could it be done differently? Those are the things that I'm sure this report that Adam and his colleagues will be looking at going forward. As Rachel said, we do have quite a lot of detail. Some of you may remember last time I presented some blue triangles, which actually looked at the sort of work that was already going into those areas. So yes, so in those terms, but I suppose the other thing is really, I want you as councillors to tell me in some ways. So Councillor Hilawi is from Newport and is already, represents Newport and is sort of already involved. But one of the reasons for these sessions is sort of like, tell me how you think it might work better, or tell me how you think it might work differently, or tell me how you think it might work differently across the town, because we really want to make this a success. Really, as much as us presenting to you, we'd really like you to tell us as well, because you're out there, you know your communities, you know how to work with families, so tell us as well. I hope that's okay. I don't mean to be disrespectful. I just want your answers as well.
I'll keep that in mind, Sue. Thank you. Thanks, Adam.
Councillor Houdin.
Thanks again, Chair. Yeah. So I'd just like to ask one simple question, actually, as well, if I may. That's the working with the BME and the non-English speaking families. I understand there are quite a lot of families from Eastern Europe who do not speak English, and obviously the other BME communities as well, especially in Newport Ward. How are you managing them? I mean, are we using interpreters? Do we get easy access to interpretation services and things like that?
Okay, Angela, can you talk a bit about that, and then maybe Gail, because I can see Gail frantically nodding her head at me. But Angela, you talk to us about how you're working with the BME communities.
Yeah, we have an interpreting service that we use, and we can either get them to come on visits and come with us in person, or over the telephone. They can be used on every visit and every interaction with the family. So that's something that's quite easily available to our social workers, and shouldn't be a barrier to our work with families.
That's good. Thank you very much. Thank you.
Thank you. Councillor Morstan.
Yes, thank you, Chair. It's just about excuse me.
You've gone on mute, Tom.
Sorry about that. It was I've got a serious cough as a hangover of COVID a year ago. It's regarding rolling out this process, the locality working over the town, and I can see it being successful and to be rolled out. I could quite easily sit here in Martin and say, yes, we want it, but honestly, we don't. We do have problem families and children in Martin, but there are other areas in the town is far greater need, and I'll acknowledge that and look forward to being rolled out. Thanks, Chair.
Thank you. Councillor Wilson.
Yeah, just another one. I asked the same question about adult social care. To get more children's social workers around, could we possibly sort of consider apprenticeships in social workers in children's services? Is that a possibility?
I think there's a question for Rachel.
We do, Councillor Wilson, we do have apprentices across the service, and we do encourage that to give people, a taste and the skills and some experience in terms of social care work generally. And we've also got examples where we've supported our internal staff to actually do the social work degree. to then become a qualified social worker. So yes, we do actively encourage that and try as much as possible. We've got examples of staff who are current social workers who did, you know, start as support workers with us. So yes, we do actively encourage that.
So if you've got somebody straight out of uni that's they've got a degree of some description from uni and they decided to come off the streets and ask the question, would that be viable towards it, maybe?
We would, you know, if they applied for a sort of a support worker job, which is not a qualified social work post, they would have access to routes to learning as you know, a Middlesbrough employee, and we would support them with that. Yeah.
Good idea. That. Thank you.
Thank you. Right, could I just come in with a couple of questions for you? About social care teams. Could you explain a bit more about the single social work team assigned to locality working? How does this work? Is it one team covering North Ormsby and Newport?
Angela, and then perhaps Rachel. Angela, tell us about your team.
So it's one team of 6 social workers and myself as the team manager. Currently we've got 3 social workers assigned to North Ormsby and 2 to Newport. And then I've got another social worker, which I'm hoping to use if needed, if I run out of capacity, if you like. As it is that I'm getting a lot more referrals coming through for Newport than North Ormsby. So I'm not sure if we've got the measure right, or that's something I need to think about, because I am getting quite a lot more for Newport than North Ormsby, which wasn't expected, I don't think. But yeah, it's just one team with me as the manager, and what I'm hoping is as we move forward and we start looking at performance measures, that will be easier because it's all within one team, and my team will be predominantly for the 2 locality wards as well.
Thank you for that.
All right.
Can I just come in with something else? With regards to schools, how have you found the working with local schools? Are the children that need help being identified and helped more within the schools?
We have close contacts with the schools across the town, and as we become more locality based, we expect that obviously those relationships are going to develop. A lot of our work takes place in schools. A lot of our direct work with children will go and see them in the schools as well, and the meetings will take place in schools. And as we know, those relationships have really developed since COVID, and we do a lot more joint working and partnership working with the school, and that's been a real positive of the pandemic.
Right, thank you. We also, with regards to the quotes that we gave, were very nice to read. Do you do these on a regular basis with the service users?
Sorry, Hazel. Sorry,
I was just going. No, it's okay. I was just going to say, from an early help point of view, when we close a case counsellor, we have an independent person from within the service who then phones the family up and asks them some questions as a result of the piece of work that's been done with them. So we do that with all cases that close, unless the family would specifically not wish that to take place. So we get that feedback, and then how we've developed that now is that member of staff will be given that feedback. So whether that's positive or areas for development, those members of staff see that, and that really encourages their practice to improve, but also recognises the great work that they're doing as well.
Right, thank you. Just another small item. With regard to the locality work with the community groups, do you know how many community groups you have in the with regards to locality work, and do they all relate to children, or it's mainly adults?
I can come in there.
Adam will have that. Adam's got that information, haven't you, Adam?
Yeah, one of the real benefits of the model is it places the community as a partner. So right at the start of the pandemic period, we did a piece of work with sort of community groups and did a bit of sort of ward mapping of what was available locally and who the larger community asset groups were. We've got detail now through a whole host of social action that we're doing with community groups on everything from sort of larger community organisations down to sort of street level community volunteers. So really sort of diverse the local offer. Also got all of the information on our sort of youth provision, our youth partners, and they're involved in the locality model, and they have been sort of really good with that sort of street level engagement of young people, and it's enabled us to. We do community consultation quite regularly, and we've committed to sort of a yearly sort of community survey, and we use that data to then push our work plans going forward for the year. What the residents are telling us, residents of business are telling us are their priorities are the things that we work on with them. And one of the things we've managed to pull out from the community asset mapping is what young people on the ward, what their priorities are. Just got the analysis of that, and we're sort of working that into sort of how we improve and how we go on there, the priorities that they've given us. So there's a massive community activity in Newport and the Thormsby. That's been a real positive sort of throughout the COVID period. Actually, a lot more smaller community groups have sort of formed through that period. So now it's just working with them to improve the ward with them. We've also got sort of a monthly stakeholder meeting that myself and some of my team hold, and that is with local community groups, charities, people involved in Newport from that perspective, and we joint work on things and feed information to and from through that forum as well, Councillor.
Right, thank you. Is there any more questions? Councillor Walker? Oh, yes, Councillor Walker.
Yeah, it is me. Yeah, it's me again. Right, I'd just like to say, I've just referred back to the minutes of your last meeting, and I did notice that, and I must have missed it, I don't know how, because I try and read everything. It's the second part regarding there was any plans to roll out the project before. You had the discussion before. Unfortunately, I couldn't be at that meeting because I've been ill for weeks now. So I'm really sorry, but it does answer some of the questions I've already asked. So I'm really pleased about that. However, one of the things that I was mentioned about the cost of these, the cost of the actual, the implications, the financial implications of rolling this out to other areas of need, and what sort of, how are you going to decide whether an area can have such as this or not? If it works out successfully now and everything indicates when you do the report that it has worked well and it is worth rolling out, what are the indicators that are going to help you choose another area or choose other areas that will help you decide who gets the locality working and who doesn't? So I just wondered what sort of thing you're going to be doing for that.
I think probably what's been described from Adam in terms of how the areas were originally decided upon. I think that's probably the same sort of process that would be gone through. I think that what we will learn from this project, we will learn where resources are best placed, for example. And children's services have become more sophisticated in the data that we also collect and look forward and use. So I think that's a bit of an unknown answer, or an unknown answer to a known question. And I think I think most of us would want to know that, but I think it's going to be really about evaluating this current project. And I think really we're going to have to sit on our hands till then. Some of us might have ideas about how we'd roll it out, but again, really, I'm open to tapping your brains, as it were, for how you think this one's working, how you think we could improve this one, and how then that might carry forward into other areas.
Right. Well, thank you very much for that anyway. I mean, there will be in the future more things to discuss, I would imagine, but I look forward to seeing what the outcomes are anyway. So it's not too long to wait, is it, really? But I just worry about, obviously there are other areas that of great need, and I think since the COVID pandemic has actually brought out a lot of distressing signs from a lot of our young people, how unhappy they are and how disjointed everything seems to be. So I'm hoping that we're going to be able to get back to what we should be with our young people in Middlesbrough total. So let's hope we can. But thanks very much for that, Sue, and thank you very much, Adam.
Thank you. Is there anybody else? Right, thank you all very much for that. Can you just let me go to the next item? It's with regard to our next meeting. Please can I ask, with regards to relevant officer liaison with us for the representative police or health or possibly community groups that use the locality working areas that we could invite to our next meeting? Could somebody come up with names that we could contact relating to this?
Councillor, I'm happy to take that forward, perhaps with Adam's support in terms of, and also colleague support. I'm not working directly in those areas, but I'm sure that we can come up with people. When is the next meeting, Jo?
Okay, so it's the 13th of December.
Okay. I'm sure we can. I'm sure we can arrange that.
Apple Watch only goes out.
Sorry.
Right, thank you for that. Now, the next
just
thing.
could add before we move on, please. Maybe we could invite some representation from a local school or two where the locality working is having effects on the community.
Yes, we will look at that definitely, Councillor Halawa. Yes.
Thank you.
Thank you. With regards to, we are going to arrange for myself and Councillor Higgins and Councillor Marsden and myself and Councillor Wilson and Councillor Marsden and Councillor Higgins to visit the hubs. If we can arrange this before the next meeting, it may not be possible because our next meeting is in about a fortnight's time. Am I right? 3 weeks' time. We'll see if we can arrange those and we'll come back with reports to the committee on that. And then after that, if any other representatives of council would like to visit the hubs, I'm sure we can arrange that. Thank you. Now we'll go on to agenda item number 5, COVID update. Sue, is that you?
Yes, Chair. There's very little to add really than what I've added before. What I've spoken for, really, it's business as usual, particularly for schools, but business as usual with caution. In terms of staff council staff coming back, we're due to go back into the office on a sort of 60-40 split from the 1st of December. So as I say, really, it's trying to do business as usual, although we know COVID is still around us and we still need to take precautions, but business as usual, but with caution. I don't think I've really got anything to add to that.
Thank you for that. I think COVID is still with us.
It certainly is.
Unfortunately, I'm afraid it's still with us and it may be with us for some time.
Please, Councillor Hilawi. Looking at statistics in Europe, Germany and Austria, for example, which have suddenly emerged this week and are quite alarming, I think we really need to be on alert to maybe change our arrangements, because I think we need to see what the figures are showing day on day, and they are very alarming at the moment. Yep. The numbers of cases, etc. I think we need to be not complacent at all. We need to be very much on the alert and aware that we might need to change our strategies in line with the statistics and the data from the health authorities. Thank you.
Thank you for that, Councillor Halawi. I totally agree with everything you've got to say regarding that. It's very frightening sometimes if you look at the numbers on a regular basis. I'll now go to agenda item number 6. Is there any more questions for Sue before I finish that? No. Agenda number 6, which is the Overview and Scrutiny Board, which met on the 9th of November. The Overview and Scrutiny Board considered the following items: Executive Forward Working Programme, update from Executive Member from Environment, Health, Finance and Governance, Councillor Cooper, Chief Executive's update, Scrutiny Panel Chair's update, Final report from Economic Development, Environment and Infrastructure Scrutiny Panel, Middlesbrough Regeneration post-COVID-19. And the next meeting of the OSB will be the 9th of December. Our next meeting is the 13th of December. So is there anything else anybody would like to add? Is there anything under any other business? Yes, Councillor Morstan.
Yes, thanks, Chair. It's just a news report that's arrived. It's about children in care. The County Council Network has their annual meeting today, and they've produced a research that claims that by the year 2025, there could be a 30%, 36% rise in a decade of children in care. How does the increase that's forecast there, how does that show itself in Middlesbrough, and how prepared can we be if this does indeed happen? Thanks, Chair.
Chair, I'll start answering that, and then I'll hand over to Rachel, if that's okay.
Yes, thank you, Chair. Thank you, Sue.
Middlesbrough has had, Middlesbrough had over, and I think it was the August before last, when 702 children looked after. That was very, very high, probably the second highest per 10,000 children in the country. And we all know that the number was too high. And one of the reasons that it was too high is because in terms of social work, particularly, we weren't moving children along to their forever homes as swiftly as we could have done. So we know that what we call permanency was one of the issues that made the inspection a really challenging inspection for us, and we were absolutely rated as inadequate. Since that time, we've done a great deal of work here, and in many ways we've bucked the trend because we've brought the numbers of looked after children right down, still high, and the northeast number of children looked after is high, and the South Tees where we are is high, and Middlesbrough is high too, and probably the highest in the northeast from that point of view, although I think Hartlepool has now overtaken us. So we've actually bucked the trend in many ways in terms of bringing down our numbers of looked after children, but they are still high across the country. So they are still high compared with those across the country. So in terms of being prepared for it, I think the way that Middlesbrough will be prepared for it is to keep improving our practice. Yeah, and we are still on a big improvement journey. We're 2 years through a sort of a three-year plus improvement journey. So in terms of Middlesbrough, we've got to keep getting better at permanency. We've got to keep getting better at getting children to their forever homes. We've got to improve our practice so that we work well. We've also got to make sure that we've got the right resources in early help so we catch those issues in families earlier. So Rachel, do you want to just come in there and perhaps give a bit more detail?
There's been quite a lot in the press over the last few days, and the reason for that is because the sort of national statutory return that we make to the Department for Education was published last Thursday. So that gives everybody in England's position as of the 31st of March this year, because we have to submit the data and they publish it. And as Sue says, last year we were second highest nationally in Middlesbrough, second only to Blackpool in terms of our numbers of looked after children per 10,000 head of population. And our position has changed, and it's due to improvement, as Sue says. So the reports that are being published and I read one yesterday, is saying that nationally children looked after numbers are going up, and also children who are secured adoptions are going down. And so, like Sue says, in Middlesbrough we have booked both trends there. So we've got a reduction in looked after children of about 23% in the last 12 months. And we've got an increase in the number of children we're managing to get to adoption. So there is a good news story in Middlesbrough. But as Sue says, demand is still high. Our numbers are still high, and I think that reflects some of the issues children are facing.
Thank you for that, both Sue and Rachel.
Thank you.
Councillor Halawi, did you want to come in?
Yes, please. I think in view of the reports that we've been reading over the last few days, the reports that Rachel just referred to, I really applaud the improvements that we've made in Middlesbrough. However, just a note of caution needs to be sounded in terms of the socioeconomic deprivation that we experience in our town and the impact and pressures that that puts on our families. And I think it's in that respect that we could see increases in certain areas despite booking the trend, as we've just said. So I don't want to put a pessimistic note on that, but it's to do with socioeconomic deprivation as well as the great work that our services are doing to keep the numbers low in children looked after and to continuously strive to reduce them. It's the holistic view of what's happening in the town in terms of the social and economic reality that our town is facing. Thank you.
Thank you. Rachel, before you come in, Councillor Mawson, did you want to add something?
No, that answer I got there was reassuring. As Alma's just said, or everybody assumed, we cannot be complacent on this issue. Congratulations on the efforts being made and the changes you've made with the new team. Thanks, Chair.
Thank you. Rachel, did you want to come in?
I was just going to add, following Councillor Halawi's comments actually, and agree with that you know, the improvements in our practice have meant we've been able to move the right children on to permanence and permanent options, or return them back home if they needed to. But the numbers are still high, and that does reflect, you know, some of the issues in the in the town. So I was just going to make that point, Councillor Halawi, that actually our numbers are still high for the reasons you describe.
Thank you, Rachel. Yes, thanks for reinforcing that notion.
Thank you. Anybody else? No? Right. I'd like to thank you all very much, officers and members, for attending this afternoon. It's a very cold day today, so I hope everybody's going to sit around the fire tonight. Thank you all and take care. Joe, can you stay online for me, please?